Hello, my name is Eric Prosher, and I'm from Jesse Brown VA Medical Center, and also my guest, we have a special guest from our medical center. This is Dr. Marina Kusid, and she is the director or coordinator of our patient-centered care program at Jesse Brown VA Medical Center. So over the next 25 minutes, I want you to stay tuned because we're going to hear about what patient-centered care is and what other initiatives that are going on related to patient-centered care and other buzzwords like whole health and mindfulness meditation and complementary medicine. We're going to figure it all out right here. So stay tuned and call us with your questions because this is a live interactive program. Call 312-738-1060. Our lines are now open. Hello, Dr. Kusid. Thank you for coming on to CAN TV, Veterans Issues.
Thank you for having me, Eric. I'm happy to be here.
Great, great. So why don't we just start off right from the get-go. I don't know if I fumbled your introduction, but your role at Jesse Brown VA Medical Center, which is 820 South Damon Avenue, is patient-centered care. And you're a physician by training?
Yes.
And you have some other training in there too. I know
I
there's
do.
a lot of credentials. Why don't you tell us a little bit about your path to Jesse Brown, how you got started, and what you've been doing since you've been here.
Sure, sounds like a plan. So yes, my role is patient-centered care coordinator. I am a family medicine physician. I practice at Women's Health Center at Jesse Brown VA and see patients there as a primary care provider. I also been trained in acupuncture. I have master's in acupuncture.
Oh, wow.
I have doctorate in naturopathic medicine, which is a form of complementary integrative health medicine. I used to work as a massage therapist. I was very much interested in sort of mind-body connection, so I'm trained as a massage therapist. I used to practice that before I went to medical school. And I am actually familiar with Jesse Brown since about 2007 when I did my residency as a UIC resident at Jesse Brown.
Wow.
I've since, when I graduated from the residency program at UIC, had my private practice, worked for Department of Defense looking into research for complementary and integrative medicine and how it can be beneficial for veterans and service members and conditions that are prevalent in that populations like post-traumatic stress disorder or depression or chronic pain. And I wanted to come back home, so I came back home to Jesse Brown VA. And my role right now is to patient-centered care role nationwide is to promote a healthcare that is patient-driven, proactive, and personalized. So just with hearing those three buzzwords, you can understand that patient is really in the center of it. It emphasizes collaborative decisions when every medical treatment plan is designed. It also very much emphasizes self-management and self-care and involvement of patient in promoting their own well-being and health.
Okay.
So what it translates to practically is implementing interventions that help patients become more proactive about their health, learn self-management techniques that can help them to stay healthy, and also introduces complementary and integrative health interventions in order to address personalized needs of each patient and their preferences for their care.
Okay, wow. So that's a mouthful.
I know.
Complementary and integrative health.
Yes.
If we were to define that further, what would you say that means? These are kind of mind-body, holistic interventions that maybe one doesn't see in medical schools or medical training?
Exactly. So I'll give you a few examples. I think it will be easier for people to connect with them. So acupuncture would be a great example,
Yes, acupuncture.
because we have so much evidence that it's effective for chronic pain. And of course, that's something that is very familiar to a lot of veterans that we see.
Yes.
And especially in this day and age when we're concerned about the abuse of opioid prescriptions,
Yes.
and a lot of patients really moving more towards sort of non-pharmacological approaches. Acupuncture could be a good function, could be a good option. Other examples will be yoga,
Yes.
Tai Chi.
Yoga's really popular in our culture, and so's Tai Chi. Yeah.
Exactly. And in addition to being popular, it also can improve strength, flexibility. Tai Chi can improve balance, so it could be useful for people with Parkinson's. And last but not least is mindfulness meditation or any forms of meditation, but mindfulness meditation specifically because it shows so much positive effects for mental health and pain.
Yes. Wow. So you've just mentioned a whole bunch of different interventions that you probably wouldn't come across in your average appointment to your primary care physician. So how does a veteran who's interested in these modalities get connected at Jesse Brown VA Medical Center?
Yeah, that's a very good question. So these are relatively new. We're just starting to implement them. So we had yoga in the past within our recreational therapy department, and that's true for Tai Chi as well. So
We also had them for many years in our transition care management clinic, or the OEF, OFOND clinic. Yes.
yeah, that's great. So what we are doing right now is when veteran is interested, that they can ask for referral from their provider to recreational therapy, and provider will need to specify in their referral that patient is very much interested in yoga, and it will be helpful for our therapists or yoga instructor to know what specific reason or sort of goal that veteran has in mind. So it could be relieving back pain, it could be reducing stress. Then when yoga instructor knows the reason, it helps them to sort of personalize the intervention.
Going back to the patient-centered care and so patient-centered care and whole health is another word here.
Yes.
Is that different than patient-centered care, or is it a branch of it, or is it a synonym? What?
Sure. So patient-centered care is more of the idea of what we would like to see. But every time when you have sort of idea up there in the clouds, you want to see practical ways of how do we get something done. So whole health care is a concept that explains how do we get it done practically. So there are a couple of ways we can do it. There are few interventions that are available in the hospital that help veterans to become more involved in their care. Remember, proactive was a very important concept of patient-centered.
Proactive. That means the patient's taking initiative.
Exactly.
Okay.
Patient taking the charge of their health and their well-being.
Okay.
So the way that could be done is to participate in our whole health facilitation groups. We have them running continuously. There are 6-week groups that meet once a week for about 2 hours for 6 weeks. And they start every third Thursday of the month.
Every third Thursday of the month.
Yeah. Okay. So we just started one now. The next one is...
What time?
That part can change because we want to make sure we accommodate veterans who can address...
Patient-centered.
Exactly.
It's got to
Who come in
accommodate
the morning
patients.
or in the afternoon. So, but we do have a phone number what veterans can call.
I was going to say, how does someone get involved? Our viewers at home, by the way, if you're watching, we have Dr. Kusid. We're talking about patient-centered care. We're talking about whole health coaching and mind-body interventions at Jesse Brown VA. So please call in with your questions. If you want to find out more about it, 312-738-1060 is for the show. Now, to get involved in whole health coaching that Dr. Kusid was just explaining, the phone number is
312 569
I don't know why we got to repeat it. 569
5395.
All right.
So that's our hotline, and anybody who is interested in this can call, and you will receive a phone call back from our veteran who is a program support for this program. Her name is Michelle Samples. She's a health facilitator, so she will call and find out what specific needs for the veteran are and the best way for them to get involved, either in the group or to work with a specific health coach.
Okay. So you were talking about, so the one of the goal of connecting patient-centered care is finding out what is important for the patient and offering modalities that they can do for themselves that would improve their health. And it's awesome that you worked for the DoD, looking at evidence that supports these different types of different types of interventions, and meditation being one of them.
Sure.
Tell me a little bit about some of these programs or these mind-body interventions that are going on at Jesse Brown. So we have Tai Chi, yoga, and meditation.
Yeah, so those are the new that we're just introducing this year. So we have other forms of complementary integrative health, but those are new that we're just getting ready to introduce
We've had
in
acupuncture
December.
and chiropractic medicine and okay.
Yeah.
So what are you most excited about of these?
I'm actually excited about
things.
all three.
All three? Okay.
And sort of one thing that unites them, they're all forms of meditation. Yoga and Tai Chi are forms of movement meditation.
Yes.
So it helps people to manage their chronic stress. And we know chronic stress is one of the factors for a lot of chronic conditions.
Yes.
Yoga is also excellent at to be used as an adjunct to conventional treatment for depression, and it's excellent for low back pain. We have a lot of patients with low back pain. So Tai Chi has a lot of research, and one of the surprising indications is osteoarthritis. So that's also very common among many veterans, just because, and it happens in much earlier age than in general population, mainly because people were carry heavy backpacks.
Injuries, yeah.
Have a lot
So
of
the average
injuries.
deployment ages a veteran 7 years. You know.
Exactly.
Meaning that some of the health problems and conditions you would expect happen 7 years earlier than they
Happen
would,
7 years earlier.
Otherwise. Yeah.
Exactly. So you have fairly young people who have joint pain. So Tai Chi is excellent for that, and also excellent for improving balance. So any conditions where balance is involved, like multiple sclerosis, Parkinson's disease, elderly people who have, balance, something that's affected by age. So I'm excited about those two. But mindfulness meditation is probably my favorite.
That's your favorite? I know mindfulness is very popular, and I've been interested in it myself and teach it as much as I can. Tell me a little bit. There's some really cool things that the VA has done to introduce and make mindfulness more accessible to the veteran using technology. Do you want to say anything about mindfulness?
Sure.
Okay.
So VA has created an app called Mindfulness Coach. It's a free app. It can be downloaded. It was created for the National Center of Post-Traumatic Stress Disorder. It's and if you just go in your app store, you can download it. It's free, and it tells veterans what mindfulness is, and it also shows them a variety of different ways that they can use to achieve mindfulness.
So if you go to your app store, it will look something like this. I know the print's kind of small, but it's got a green with the 3 bubbles there. It's called Mindfulness Coach, and it's through the National Center for PTSD that developed it. And also have a little video at home to give you some more information. We'll talk more about mindfulness in a couple minutes.
You may have heard this word mindfulness. It's become something of a buzz phrase of late. So I'm going to give you one simple, serviceable definition, which is this. Mindfulness is the ability to know what's happening in your head at any given moment without getting carried away by it. Imagine how useful this could be. Just as an example, you're driving down the road and somebody cuts you off in traffic. How do you normally react? I think most of us, we normally react by having a thought, which is, I'm pissed. And then what happens next? You immediately, habitually, reflexively inhabit that thought. You actually become pissed. There's no buffer between the stimulus and your reaction. With just a little bit of mindfulness, in that same situation, you might notice my chest is buzzing, my ears are turning red, I'm having a starburst of self-righteous thoughts, I'm getting angry. But you don't necessarily have to act on it and chase that person down the road, screaming at them with your kids in the back of the car thinking you've gone nuts. Now, you might be thinking, don't I need to get angry sometimes? Aren't I justified? I would say yes, but probably not as much as you think. The proposition here is not that you should be rendered by mindfulness into some lifeless, non-judgmental blob. The proposition is that you should learn how to respond wisely to things that happen to you rather than just reacting blindly. And that, my friends, is a superpower. How do you get it? The way to get it is through meditation. I believe that meditation.
Wow, so that's a cool little video.
Yeah.
Mindfulness, which, according to this video, gives you
It's a superpower.
superpowers. Yes,
Yeah.
yes. And my understanding is mindfulness has really 4 components. One is there is attention. You have to have control over your attention. And then there's intention. You set intentions. And the other is present focus, being present to the now. That's where the attention and intention come into play. And the last one is really important that helps is the non-judgment. That we walk around, we have stories, we're always judging our experiences, and this is part of the stressed out mind. And that learning to not judge your internal experiences kind of gives you some freedom and control to discriminate better.
Yeah,
anything
that's
else to say?
yeah, that's exactly right. So, and one might ask, how can it help my pain? And what researchers found that a lot of our experience of pain has to do with things like anticipatory anxiety, when you know that you're going to go up the stairs and your knee's going to start hurting. So there are neural pathways that are involved in us experiencing pain, and mindfulness meditation actually is able to alter that. So when research was done on pain and mindfulness meditation, what researchers noted that after 8 weeks of practicing, anticipatory anxiety related to pain decreased. Depression, which is very common with chronic pain, and depressive symptoms decreased. Pain intensity decreased. And sort of quality of pain also changed. So by observing their own experience non-judgmentally, patients were able to focus more on sort of physical manifestation versus all of the cognitive and emotional appraisal that goes around it. So
The secondary kind of cut.
exactly,
Yeah,
kind of the
yeah.
vicious cycle where
Yeah.
physical sensation gets escalated by our perception of it.
Yeah.
Yeah.
I often tell my patients that, and so a part of kind of being aware and willing to be present with your pain kind of cures or helps out your suffering, so the cure to your pain or a cure to your suffering is through your pain rather than away from it, because a lot of people they don't want to think about it, they don't want to feel it, they just want to avoid it, but when we kind of suppress these things, they become more intense later on.
Yeah. So it's really about sort of honest, objective observation of it.
So let's take a look at what else we have here to say about.
Despite what you may have heard, meditation does not involve joining a group, paying any fees, wearing any special outfits, sitting in a funny position, or believing in anything in particular. It is simple, secular, scientifically validated exercise for your brain. You don't have to do it yet, but just so you know, here are the 3 steps. 1, sit with your back straight and your eyes closed. 2, notice the feeling of your breath coming in and going out. Pick a spot where it's most prominent. Usually that's your nose or your chest or your belly, and just focus your full attention on the feeling of your breath coming in and going out. Now, as soon as you try to do this, your mind's going to go nuts. You're going to start thinking about, what am I going to have for lunch? Why did I say that dumb thing to my boss? Your brain's going to go nuts, and that's fine. The whole game is to notice when you've gotten lost and to start over, and then to start over again and again and again. every time you do that, it's like a bicep curl for your brain, and it shows up on the brain scan. Scientists have found this in the lab. It's also, by the way, a radical act. You're breaking a lifetime's habit of walking around in a fog of projection and rumination, and you're actually focusing on what's happening right now. Meditation is unlike anything you do in the rest of your life. Failure is actually success. As I said, the whole game is just trying, failing, starting again, failing, starting again. Here's my advice. You should be meditating every day, 5 to 10 minutes a day. That's it. This doesn't require some giant investment. I don't care how busy you are. You have 5 to 10 minutes to give this a shot. I guarantee you it will make a big difference.
Oh, wow. Wow, that was very refreshing. What a cute little video, of very instructional.
It's a very cute cartoon.
yeah.
It's good for children too.
Yeah, yeah.
And that's probably a good thing to practice as a whole family.
Yes,
Yeah.
with the whole family. Wow, so we have a couple minutes left. Want everyone there to know that you've been watching CAN TV, Jesse Brown, VA Medical Center, and I really want to thank Dr. Kusid, Marina, for coming on and sharing a little bit about patient-centered care initiatives. And I hope you can come back and talk more, because our time flew by. It went by really quickly.
Sounds like a plan.
And if people are interested in finding out more about whole health coaching or any of the Tai Chi, mindfulness meditation, and yoga practices at Jesse Brown VA, they can call 312-569-5395. And don't forget, it is get your flu shot. It's flu season, so we also have a walk-in, and you can go to Walgreens. But Jesse Brown also has an open house November 1st, at 9 a.m. to 2 p.m. on the second floor of the Damon Pavilion. And also, veterans, if you need to talk to someone 7 days, 24 hours a day, there is a crisis line called 1-800-273-8255 or 1-800-273-TALK, and press 1 for veterans, and you can talk to a live person any time of the day or night, and we'll connect you to the local resources, the closest VA to you. So again, my name's Eric Prosher. This is Marina Kusid. We represent Jesse Brown VA Medical Center, the best VA in Chicago. And I'd like to thank you for watching CAN TV 21. And please tune in. We'll be here next month. And please stay tuned for West Garfield Park Youth Council to follow in 5 minutes.